say who you are.
I'm Dr. Dr.DaVanzo. I have a private practice on St. Simon's Island, Georgia, and I practice general psychiatry.
Okay, where did you go to medical school?
East Carolina University School of Medicine.
Okay. Thank you for meeting with me.
You're welcome.
Okay, so I am taking a psychology of aging class, and we have been talking about people pretty much 65 and older. And today I'd like to talk to you about mental health issues and treatment.
Okay.
Really with your patients that are older adults.
Okay.
So a lot of the disorders that we've been discussing are depressive disorder, anxiety disorder, OCD, schizophrenia, neurocognitive disorders, and substance-related disorders. So I was wondering if we could go maybe step by step, maybe talk about each one and the prevalency of them and what you've experienced with your patients.
That sounds great.
Okay. So I would like to discuss major depressive disorder first. According to my book, 60 and younger are twice as likely to experience major depressive disorder, and the average age is 32. But men really suffer from the symptoms 60 through 80. Have you experienced a lot of major depressive disorder in your patients?
Interesting question. Yes, I have. Interesting that there's a lot more major depressive disorder in the younger than 60 age group, with a median age of 32, because you think of 32 as being a young prime time of life, but that's actually when the majority of depression can occur in the 30s. As far as the 60s, for women and men tend to be a little different. Women in their 60s and older tend to have episodic depressive episodes, which can be very, very severe. And they can last up to a year to a year and a half in terms of the length. They're very hard, drug resistant, hard to treat. And I've had numerous women that have had these, but once they have gone into a remission, they have been very, very well. Very interesting group of people. As far as the elderly men, they tend to actually have more chronic depressive symptoms, and they actually don't remit as easily and don't tend to follow up and complete treatment as frequently as females.
Okay, thank you. How about bipolar, manic depressive disorder? Do you see that a lot?
Bipolar episodes, bipolar disorder is fairly uncommon in general. It's less common than major depressive disorder. In elderly people, bipolar disorder tends to be present itself more with the major depressive symptoms, with the symptoms of bipolar depression, rather than the episodes of mania. Episodes of mania can occur in the older years, and that usually is characterized by decreased need for sleep and severe irritability.
Interesting. Okay, I'm going to move on to anxiety disorder. I read that this disorder is the most highly prevalent of all the psychological disorders, with the exception of substance abuse disorder. Do you see a lot of anxiety disorder?
Yes, anxiety disorders are very, very common across all age groups. There's numerous types of anxiety disorders, including panic disorder with agoraphobia, social phobia, generalized anxiety disorder, obsessive compulsive disorder. So these are all types of anxiety disorders. They're very common across the board. And the elderly, there's no exception. They are common. They are probably one of the leading causes that the elderly patient comes to a psychiatrist and requests to be treated.
All right. Okay, and now I'd like to talk to you a little bit about trauma and stress-related disorders.
Well, stress-related disorders, again, are uncommon, but they can be severe. They are They occur generally after a traumatic event in which you witness or have a close call in which your life is threatened or another person's life is threatened, or a terrible accident. These can cause post-traumatic stress disorder. Post-traumatic stress disorder can be acute or chronic. Includes feelings of being overwhelmed, feelings of hypervigilance, feelings of irritability, freestanding anxiety, nightmares, flashbacks, and these are treated with psychotherapy and with medication.
Okay, great. Do you have a lot of patients that suffer with schizophrenia or other psychotic disorders?
At the age of 60, 65 and older, there are some schizophrenic patients, of course. These, due to the severity of the symptoms of schizophrenia, patients tend to decompensate over time and do poorly as they age. Schizophrenia is also a risk factor for early death related to chronic illnesses such as smoking-related illnesses, diabetes, weight-related illnesses, cardiovascular illnesses. So there are actually not as many schizophrenic elderly patients as there are younger schizophrenic patients. They don't tend to have a long lifespan.
Okay. How about substance abuse disorders? What kind of abuse do you see happening in 65 and older?
Substance abuse disorders are very common among all age groups. Alcohol abuse disorder is one of the more common substance abuse disorders. Nicotine abuse or nicotine dependence is also very common. Although, again, in the elderly, nicotine abuse or dependence is not as common because it is a risk factor for a shortened lifespan. Also, you'll see use of prescription medications and abuse of those medications, including the benzodiazepines, which are used for anxiety, and the opiates, which are used for pain management. Those are the most commonly abused prescription medications.
Okay. And last question, personality disorders. We have borderline personality disorder and maladaptive disorders.
Well, the personality disorders are clustered into three different clusters. Cluster A, B, and C, the weird, wild, and wacky. They are common amongst all age groups, so they tend to be common throughout the life cycle. I think as people age, they tend to mellow out for the most part. So personality disorders, which would gain attention in the earlier age, tend to mellow out as people get older, and they tend to be less intrusive, and less obvious. But they are still there. I think people just tend to mellow out and calm down as they get older.
Well, thank you so much, Dr. DaVanzo. I really appreciate you letting me interview you. This is going to be great for my project.
You're welcome.
Okay, well, thank you very much.